Anaphylaxis. Anaphylaxis is a life-threatening allergic reaction that happens very quickly. It can be caused by food, medicine, or insect stings. Call 999 if you think you or someone else is having an anaphylactic reaction. Symptoms of anaphylaxis. Symptoms of anaphylaxis happen very quickly. They usually start within minutes of coming into contact with something you're allergic to, such as a food, medicine, or insect sting. Symptoms include 1. Swelling of your throat and tongue. 2. Difficulty breathing or breathing very fast. 3. Difficulty swallowing, tightness in your throat or a hoarse voice. 4. Wheezing, coughing or noisy breathing. 5. Feeling tired or confused. 6. Feeling faint, dizzy or fainting. 7. Skin that feels cold to the touch. 8. Blue, gray or pale skin, lips or tongue if you have brown or black skin. This may be easier to see on the palms of your hands, or soles of your feet. You may also have a rash that's swollen, raised or itchy. Causes of anaphylaxis. Anaphylaxis happens when your body has a serious reaction to something you're allergic to. Allergies that can sometimes cause anaphylaxis include 1. Foods such as nuts, cow's milk, eggs, fish or sesame seeds. 2. Medicines such as antibiotics or non-steroidal anti-inflammatory drugs, NSAIDs. 3. Insect stings such as wasp and bee stings. 4. Anesthetics. 5. Latex, a type of rubber found in some rubber gloves and condoms. Sometimes it's not known what caused an anaphylactic reaction. What to do if you have anaphylaxis. Follow these steps if you think you or someone you're with is having an anaphylactic reaction. 1. Use an adrenaline auto-injector, such as an EpiPen. If you have one, instructions are included on the side of the injector. 2. Call 999 for an ambulance and say that you think you're having an anaphylactic reaction. 3. Lie down. You can raise your legs, and if you're struggling to breathe, raise your shoulders or sit up slowly. If you're pregnant, lie on your left side. 4. If you have been stung by an insect, try to remove the sting if it's still in the skin. 5. If your symptoms have not improved after 5 minutes, use a second adrenaline auto-injector. What are the stages of anaphylaxis? Anaphylaxis tends to happen suddenly and quickly. There often isn't a warning period, but there can be mild signs like hives or flushed skin. Some healthcare providers break the stages of anaphylaxis into 4 categories. 1. Stage 1. Mild anaphylaxis is the first stage and can cause symptoms like skin rash or redness, itching or hives. 2. Stage 2. Moderate anaphylaxis happens when a person has more widespread and extensive symptoms like skin rash and hives that are spreading or mild swelling in their lips or tongue. 3. Stage 3. Severe anaphylaxis happens next and involves a person displaying signs of difficulty breathing, extensive swelling, weak pulse or dizziness. 3. A person in stage 3 anaphylaxis is experiencing a condition called anaphylactic shock. 4. Stage 4. Life-threatening anaphylaxis is the last stage and involves a person losing consciousness, being unable to breathe and having inadequate blood flow to vital organs. 4. A person in this stage needs immediate medical attention to avoid death. Diagnosis and tests. How is anaphylaxis diagnosed? If you've had an allergic reaction, or suspected allergic reaction, to food or insect stings, even a mild one, talk to a healthcare provider. A provider can often diagnose anaphylaxis based on your symptoms. They should refer you to an allergist, who can perform additional tests, determine triggers and teach you how to avoid those triggers. Taking this important step can protect your health and even save your life. It applies to anyone who's had any type of allergic reaction. What tests can diagnose anaphylaxis? An allergist may recommend performing a skin test or a blood test to confirm an allergy and identify the specific allergic trigger. A skin test places a small amount of the allergen on your skin to see if it causes a reaction. A blood allergy test involves your provider taking a blood sample from a vein in your arm. Treatment for anaphylaxis. Anaphylaxis needs to be treated in hospital immediately. Treatments can include 1. Adrenaline given by an injection or drip in your vein. 2. Oxygen. 3. Fluids given by a drip in your vein. You'll usually stay in hospital for around 2 to 12 hours, but you may need to stay longer. Before you leave hospital, you'll be given 2 adrenaline auto-injectors to keep in case you have another anaphylactic reaction. An adrenaline auto-injector is a special device for injecting adrenaline yourself. You'll be told how and when to use it. If you know something extra about this, then comment below, because this will helpful for us. At the end, it is requested to please subscribe our channel.